Well, good morning, everyone. Thank you for joining us for this webinar. We look forward to sharing information with you about the COVID-19 vaccine and how your employees can sign up for a shot throughout WellSpan. I'm Carrie Willits, Senior Vice President of the Eastern Region for WellSpan and also the executive sponsor of our Business Development Division. I am joined today by Marissa Michaels, VP of Business Development, who joined our team in August. Marissa joins us from Ohio, where she has worked for over 20 years to assure high-value partnership between health systems and employer partners. We are excited to have her leadership. You may recall the themes of our conversations last spring, which included a call for us to work together to manage through this pandemic. Our collaboration couldn't be more critical now as we work together with everyone in our community to make an informed decision about receiving the COVID-19 vaccine. We're more than 10 months into the pandemic. No matter the group you represent, there's no denying this has been a challenging time for all of us. Many of you are also on the front lines, and we're very grateful for all you do for our communities. WellSpan's 20,000 leaders, physicians, and team members have brought their best to our mission every day. It's the same spirit we see in all of you, and we thank you for that. We all know that COVID-19 has claimed the lives of many across our service area. It is why we are excited to have another tool in our toolbox, a vaccine, for helping to protect your employees so you can safely operate your businesses. Today, we'll use this time to talk about the safety and efficacy of the COVID-19 vaccine, as well as possible side effects and logistical considerations for your employees planning to get vaccinated. We will also share the logistics of how to sign up for a vaccine and make sure we're explaining WellSpan's phased approach. I'm joined by WellSpan's Dr. Mark Godecker, Vice President and Regional Medical Director of the medical group, WellSpan's medical group, and Dr. Eugene McElwee, Medical Director of WellSpan Occupational Health. They will share with you WellSpan's phased plans for vaccine distribution, details about the safety and efficacy of the vaccine so you can make an informed decision when the vaccine is available to your employees, and information on WellSpan's Occupational Health's newest offering, rapid antigen testing. This is an option available to employers to help them make a safe workplace and to return asymptomatic employees to work in 7 days rather than 10. We'll have time at the end to answer the questions you have. We ask you to use the chat function at the bottom of your screen, as well as we've received many questions in advance that we're preparing to answer. And my colleague, Andy Siebold, the Director of Business Development, will facilitate this portion of the webinar. Also know that we are recording the webinar and we'll send this to you later today so you can share with colleagues if you'd like. So let's get started by inviting Dr. Mark Godecker to share some important information about the vaccine. He's been working hard, not only caring for patients, but helping to plan our vaccine clinics, and has great information to share. Welcome, Dr. Godecker.
All right, thank you, Carrie. I appreciate that introduction. So I'm going to share with you a bit about vaccine development and authorization, as well as safety and efficacy. I also want to share information about the state's distribution plan and how that impacts WellSpan's vaccination efforts. In response to the pandemic, our country has focused all efforts on creating a safe COVID-19 vaccine. This means fewer barriers, more hands on deck, and increased funding to achieve our collective goal. The U.S. government has coalesced both public and private sectors to coordinate strategies to prioritize and accelerate the development of the most promising vaccines. In addition, the federal government has made investments in the necessary manufacturing capacity at its own risk, giving companies confidence that they may invest aggressively in the development and faster distribution of the vaccine. However, efforts to speed vaccine development to address the pandemic have not sacrificed scientific research standards or integrity of the vaccine review process or safety. So let me talk a little bit about distribution plans. WellSpan continues to work closely with the Pennsylvania Department of Health to obtain shipments of the vaccine. As was mentioned, WellSpan was among the state's first 100 hospitals to receive shipments from Pfizer. We're distributing the vaccine in alignment with the Center for Disease Control and Prevention guidance and the Department of Health's phased approach to vaccination. Just to remind you, Phase 1A, which was just expanded last week and is our current phase, this includes vaccinating healthcare personnel, EMS first responders, people 65 and older, or people 16 to 64 that have health conditions. Phase 1B will include first responders, correctional officers, food and agricultural workers, United States Postal Service workers, manufacturing workers, grocery store workers, education workers, clergy and support for house of worship, public transit workers, and individuals caring for children and adults in day programs. Phase 1C is the full population supply. This includes providing access to a safe and effective vaccine for the entire population. At WellSpan, vaccinations are well underway. We've already provided over 29,000 doses and have vaccinated over 24,000 people. We are working with the state to get additional shipments of the vaccine, and we want to develop as many appointments as we safely can. As soon as the state announces changes to the phases, we will communicate with our employer partners. We are encouraging you to prepare as much as possible. Your staff will sign up via MyWellSpan. We will send instructions in the toolkit following this webinar. They will self-identify their profession. When the state moves us into the proper phase, we will reach out to them to schedule a vaccine. The state is committed to having enough vaccine supply to provide patients with the second dose of the vaccine at 21 to 28 days after the first dose. We're so proud of our teams for distributing safe, timely vaccinations, and we're ready to continue receiving shipments. So let's talk a little bit about vaccine safety. Both the Pfizer and Moderna vaccines, the two available vaccines, have been through rigorous process before being authorized as safe and effective for emergency use by the Food and Drug Administration. Additionally, I and other WellSpan experts have carefully reviewed the available research data. We also find the vaccine to be safe and effective. As with any vaccination, there are some individuals who shouldn't get the vaccine or who should take additional precautions. The vaccine is not recommended for those who have had a previous allergic reaction to any components of the vaccine. That list of components is available on the CDC website. It is also available at our vaccination centers. The vaccine, if you've had a previous allergic reaction to any vaccine or injectable medication, we'd encourage that you would speak with your provider first. If you've had COVID-19 and were treated with the antibody treatment, you should wait at least 90 days until after that treatment before receiving the vaccine. If you recently received another vaccine, you should wait a minimum of 14 days before receiving the COVID-19 vaccine. Those who are pregnant, breastfeeding, or immune compromised may choose to be vaccinated. We recommend these individuals have conversations with their providers to make informed decisions about being vaccinated. I also want to talk a little bit about vaccine efficacy. One of the things that we know about these vaccines is that they are extremely, extremely effective. So the question is, how well do they really work? So it's important to keep in mind that no vaccine is 100% effective, but studies have shown both Pfizer and Moderna are over 90% effective, which is very, very promising. Both vaccinations require 2 doses. Around 1 week after the first dose, you will be about 52% protected, around 2 weeks after receiving the second dose, you'll be upwards of about 95% effective. Both of the vaccines work by the same biological mechanism. It is important to complete your vaccination series with the same product. At this time, the vaccines are not interchangeable. The safety and effectiveness of mixed vaccine series hasn't been tested. As a frontline physician, I was in the first tier of phase 1 vaccination. I was very fortunate to be there. I received my second dose of the vaccine about 2 weeks ago. I did have a sore arm the next day or for about 2 days afterwards, but otherwise I had no other symptoms. It was a great day knowing we have new tools and science in hand to protect ourselves from COVID. I want to talk a little bit about the vaccine side effects. As I mentioned, I had the sore arm afterwards. Most people do not have serious problems after being vaccinated. However, your arm may be sore, red, warm to the touch. These symptoms usually go away within 2 or 3 days. Some people report getting a headache or fever after getting the vaccine. These side effects are a sign that your immune system is doing its job. It is working to build up protection to the disease. We will observe you for about 15 to 30 minutes immediately following your vaccine to make sure you're not experiencing an allergic reaction. During that time, our team can help to make sure that you sign up for your second dose. Another question that we've heard a lot, specifically with this audience, is should I encourage my employees to stagger their vaccinations a bit in case they experience side effects? We would encourage you, especially to do this if you have a temperature check at your workplace. Staggering is a good idea to avoid a shortage of workers. We have noticed more with the second dose. Our team members seem to have experienced a low-grade fever and some achiness. I know many of you have seen in the news about the new strains of COVID that are being identified. All viruses mutate, so this isn't surprising. The COVID virus has been mutating since it was first discovered. It is believed that the new strains mutations make it more contagious, but the structure is not significantly different. So what does this mean? It means that the antibodies produced as a result of being vaccinated will still protect you from the new strains of COVID. So it makes it even more important to be vaccinated. The fact that the new mutation is more contagious and spreads faster is just one more reason people should choose to be vaccinated when it becomes available to them. Currently, the CDC and research experts at both Pfizer and Moderna believe the current vaccines will protect against these new strains. In addition to sharing information about vaccination, we're encouraging people to continue to practice safe behavior. Vaccination is just one more tool to keep us healthy. Until we have widespread vaccine, we must continue to protect ourselves and others. I want to thank you for being our partners in striving for a healthier community. I am now going to turn it over to Dr. Eugene McElwee for some details on our antigen testing. Dr. McElwee?
Well, thank you, Dr. Godecker, and hello, everyone. So it's great to see the work and the coordination of Dr. Godecker and our WellSpan teams. And as your occupational health partner, we look forward to extending our vaccine to our team members. I'm just going to give you a little bit of information about COVID-19 and the workplace. We've been hearing some common points of confusion, so I thought I'd spend a few minutes just trying to share some information to help you feel a bit more prepared about the expected phase changes. Quite a few people have asked me who is considered an essential worker. The Pennsylvania Department of Health is guiding the classifications, so they are the best source for this information. Their full plan, noting which business types and roles are in the various phases, is available on their website, and that can be accessed at health.pa.gov. But generally speaking, their definition of essential workers are those who are essential to continue critical infrastructure and maintain the services and functions that Americans depend on a daily basis. As Mark stated earlier, education employees are part of the phase 1 grouping, along with other sectors that include the first responders, people in critical manufacturing, those in food and agriculture, public transit, congregate care settings outside of 1A, and those caring for children or adults in day programs, with some additional high-risk service sectors. So again, this and other details can be found on the Pennsylvania Department of Health's website. I can tell you the CDC also has a good tool that helps differentiate some of the categories within these broader categories. So for instance, if you're not quite sure which category you may fit in, they actually break it down into subcategories. The COVID vaccine will be free. However, the vaccine administration charges will be billed to insurance, but there will be no out-of-pocket costs incurred by the patients or your employees. Another question we've had is, can employers mandate that employees get the vaccine? And as we understand, it is legal for business to make employee vaccinations mandatory. But neither the Pennsylvania Department of Health nor WellSpan Health are mandating the COVID vaccine. At WellSpan, we're strongly encouraging our employees to get vaccinated, and we share the safety and efficacy with the employees so that they can make a more informed decision. So where will our employees be able to receive the vaccine? Employees will be able to select one of the more than 20 locations across our region to receive their vaccine. Our teams are also developing plans for additional locations, and we'll continue to communicate with our employer partners as the system adds new sites. This information will also be found on the My WellSpan. When your employees go to schedule their vaccine appointments, they'll be able to see the different sites that they can choose. So while we're waiting for the phase change to occur, I did want to share some information about a new offering through WellSpan Occupational Health that can help you to maintain a safe workplace. We're now offering the rapid antigen testing. The purpose of the occupational health COVID rapid antigen testing is to decrease the number of days an asymptomatic employee is out of work following an exposure to a positive COVID person. So assuming a negative test, no new onset of symptoms, this will allow the employee to return to work at day 7 rather than day 10. And this is in accordance with the Pennsylvania Department of Health guidance. The COVID test is offered at WellSpan Occupational Health, and it's for those employees who meet the following criteria. It's been at least 5 days since the employee was exposed to COVID-19 positive person. The employee has been asymptomatic since exposure, and the employer requires this testing for the return to work of its employee. The employers will be billed a $30 administrative fee, and this fee can be subject to change based on current supply and availability of the testing platforms that we're using. Some of the reasons the COVID rapid antigen test may not be suitable would be those employees who are symptomatic. If they are symptomatic, they should be seeking care from their primary care physician or one of the urgent care centers. This testing is also not suitable for those employees seeking to return to work following a positive test result. It's also not suitable for those who seek testing prior to or following travel. Air travel requires a different type of test, a PCR test, in order to be recognized by TSA. We do recognize that there may be other opportunities for employees who do travel based on the type of work that they do. If you're interested in participating in this new service, please send an email to occupationalhealth@wellspan.org. Your email should include antigen testing in the subject line for specific follow-up. We'll respond to your email with the operational details, which will include the COVID test authorization form that you'll need to complete and the scheduling link for your employees. We'll send this information in an email following the session. So now we're going to take a little bit of time to answer some questions. If you could please submit them via the chat function. Our colleague, Andy Siebold, is now going to help moderate with those questions.
Thank you, Dr. McElwee, and thank you all for joining us again today. So we're going to start with questions that have been submitted during the registration process, and I would encourage you again, use the chat button at the bottom of the screen and submit any additional questions that you may have. So we're going to start with Dr. Godecker for a couple different questions here. Question number one, current status of vaccine availability, and when can we expect to move to the next phase?
Yeah, Andy, the million-dollar question, so to speak. As we, many of you have heard in the news about the vaccine supply. We get the vaccine comes through the state to WellSpan, which then comes through the federal government. So we are planning and doing all of our planning of future phases when we get adequate supply and when the state would then say, you know, it's time to move on to phase 1B. So we are preparing for it, so we are ready. A great example of that was last week when the state expanded the 1A and allowed us to start vaccinating patients. That day, we were able to open up our schedules. So we will continue to work with the state. We have a very good partnership with them. We are hoping that we can continue to get a large amount of vaccine supply and get it administered as quickly as possible.
Thank you. In terms of a sense of when the vaccine will be available, how will people know when it does become available?
Yeah, so we've encouraged everybody to go on to my WellSpan, so we would encourage your employees to do that. Please sign up for it. This is a way that we can get information and get people's names so we know who is interested in the vaccine. They would sign up for it. They answer a few questions. Their name then gets put on to an area so we can track that and we can put them in the right group or the right category. When that category comes up, we can then reach out and contact those patients to let them know that it's ready. As we get more vaccine, we will continue to open up more appointments.
Great. Another good question, and what I oftentimes hear is, will I need to get a yearly COVID-19 vaccine?
We do not know yet. I am hoping no, but right now, what we look at is mutations. So we know when you look at the flu vaccine and influenza, there are different strains each year, and they mutate. So we have to change what's in the flu vaccine each year. With COVID-19 so far, even though there have been mutations, we still believe that the vaccines we have will still be extremely effective to prevent spread of this disease. That could change. You hope not, but they continue to look at it and they continue to do ongoing research.
Thank you. Question about the Pfizer vaccine versus Moderna. Any recommendation of should I choose one versus the other, or are there different side effects to one versus the other?
Yeah, so the Pfizer and Moderna vaccine are both what are called mRNA or messenger RNA vaccines. So they're the same type of vaccine, the same technology. They both work equally effective. Like I had said earlier, if you get 2 shots, they're about 94 to 95% effective. The big difference is the Pfizer, you get dose 1 and then dose 2, you can get 21 days apart. With Moderna, it's 28 days apart or farther. Other than that, the side effect profiles are fairly similar. You get sore arm, redness, you might get some low-grade fever, but they're both fairly similar for both. I did hear someone the other day said, the people that get vaccine X versus vaccine B are getting sicker, and there's no data to support that. So if you do hear anything like that, there's really nothing that has shown that that's the case.
Wonderful, very helpful, thank you. So I'm going to switch over to Dr. McElwee. One of the questions we're oftentimes hearing is, will WellSpan be coming on site to employers to deliver the COVID-19 vaccine like we do for flu vaccines?
Yeah, I think we need to recognize that flu vaccine is very different than the COVID vaccine. There are a lot of different logistical issues that need to be dealt with. So those employers who have had on-site vaccine programs, it's not quite the same. So the initial strategy is to provide vaccines through these multiple points of distribution, or what we call them pods, and they'll be located throughout the different regions. So that will be the initial focus. Our role in occupational health is to partner with our employers and to help facilitate that process by providing some communication tools and to assist their employees. The longer term strategy may include some on-site vaccine administration, in part depending on the availability and the type of vaccines that will be available as we move through the different phases.
Very helpful. Another question, do employers need to provide a vaccine voucher to their employees or other kind of proof to justify that they're in the current phase?
My understanding is that when employees go into my WellSpan to choose an appointment for their vaccine, there is a questionnaire that allows them to self-identify the type of employee they are or what their occupation may be. But I'm not aware of any process where the employer will need to provide any types of vouchers or identification for them to be able to receive the vaccine.
Thank you. What can employers do to promote the safety of the vaccine and to get employees engaged to get the vaccine?
I think that's probably where occupational health will provide a role for the companies, is to provide the ongoing communication and some of the tools that we have available through WellSpan, whether that may be information on the efficacy and safety of the vaccines, whether it's helping those companies who may have employees with limited English proficiency, helping employees who may not have the technology to register for my WellSpan. There are ways that we can assist the employers to facilitate their employees registering for the vaccine and having a better understanding of the safety of it.
Great, thank you. Now I'm going to turn questions over to ones that are just coming in through the chat. So if you have essential employees who are in different states, are they able to still come into WellSpan and get the vaccine through us?
Andy, yes. So if there's no state line restriction with the vaccine, so if you have employees that are coming in, and obviously our area, because we're so close to Maryland, that's a big issue. But yes, if they're coming in from other states, but they are employed by you and we're doing the vaccination, they can be vaccinated in our area.
Great, thank you. I believe you've already addressed this, but maybe restate it again. The WellSpan website says appointment availability is currently not accepting vaccine appointments. Do we have a sense of when those appointment opportunities would open up?
Yeah, just to give you an idea, I believe we had around 46,000 appointments that were booked, somewhere in that range, in the first 32 hours last week that we opened this up to the expanded phase 1A, just to give you an idea of the demand. Right now, it really does depend on the supply. As we get more supply, we will be able to open up more vaccine appointments. There was a question in the chat box, do we have enough available vaccine to cover all of our scheduled appointments? And we do, but we continue to work with the state of Pennsylvania to make sure that we do have enough vaccine. So we don't want to open up appointments and then have to cancel them because we do not have the adequate amount of vaccine.
Excellent. There's a question that just came in. At which WellSpan locations are you able to go and get a vaccine when available? So I can answer this. So this was actually just updated last night on our wellspan.org website. If you go under the COVID section, you'll see on the right-hand side a location of the current distribution sites where we're giving vaccines, and there are directions to go to those sites as well.
Yep, and Andy, there are over 20 right now. We continue to look to make sure that we are meeting the needs that of those locations. And then there was a question about do we have Moderna or do we have Pfizer vaccine? We actually have both, but we do not have every vaccine at every pod. I'm sorry, every vaccine site. So one vaccine site might have Pfizer, another one might have Moderna. If you had questions about that, we can answer, but really we would encourage you, both vaccines are very equivalent.
Excellent. Dr. McElwee, how long does it take to get results from the antigen testing that you described?
So the actual time to process the test is 15 minutes. Our goal is to have those results back to the employee and the employer within 1 hour.
Great, thank you. Dr. Godecker, if you could address employees, can they sign up on the WellSpan portal and will they get notified when the vaccine is available?
Yes, so yeah, employees can absolutely go in, sign up on the WellSpan portal, the My WellSpan. That's what we've encouraged everybody to do. You cannot schedule right now because we're 100% booked into March and April, but by doing that, your name then is in there, and we know which category you're in or which group you're in, and then we can, when that information or when it's released or when we have more appointments, we can then send out that information.
Great. Dr. McElwee, great question on once more and more people get vaccinated, do people still need to wear a mask and social distance?
My understanding is that the guidelines will still remain in place despite vaccination. So we still really need to encourage people to mask, to maintain social distancing, good hand washing, disinfecting of workstations and workplaces. So while more and more people become vaccinated, we still have to recognize that there's part of the population who may choose not to vaccinate. And that even though you've had one vaccine shot, that does not provide full immunity, because certainly that doesn't occur until sometime after your second vaccine shot. So those recommendations would still remain in place.
Very good. Another question, for those who already scheduled their first dose of the vaccine through WellSpan, is there enough vaccine allocated for the second dose?
Yeah, so the state's been working with us, and I can't emphasize how great of a partner they've been. We have regular meetings with them to make sure that they understand what we're doing, and they will relay back to us what's going on with supplies. But we provide them with the numbers that we vaccinated for a first dose, so then they know how much of a second dose that we will need, and they know the time frame. So if we use 100 doses of Moderna, they know in 4 weeks we're going to need 100 doses of Moderna to do the second dose. So they've been great at that.
Great. Another question. Once I become vaccinated, if I get exposed, do I still need to quarantine for work?
That's a great question. As of right now, that has not changed. We know that while the vaccines are extremely effective, you can still get COVID-19 after you've received the vaccine, and you can still spread COVID-19 after you receive the vaccine. So right now, the CDC, we're still following the CDC and the State Department of Health guidelines when it comes to that.
Excellent. So efficacy of the two vaccines are the same, question mark?
They are. I believe and I might get this wrong. One of them was 95% and one was 94% effective. To give you an idea, they studied a Pfizer vaccine. They had 45,000 people in that trial. And they will continue to follow these patients for the next 2 years. That's what they normally do with the vaccine trial. But most of the data that comes out about how it works is within the first 3 months. And then Moderna, I believe, was 94% effective, but that's essentially the same. And Moderna had about 30,000 people in their trial.
Excellent. Any feedback or information you can share about the new strains that are coming out?
What we know, there are subtle changes in the virus, is what they've seen. We know that we believe it is more contagious. That is the biggest change, but you would then say, well, how much more contagious? And I don't know if we know that completely. Just to give you an idea, the typical coronavirus is pretty darn contagious. If you have one person that has it and they don't wear any mask or anything, they typically will spread it to 4 or 5 people. And so thinking about that, I think the key with this is that we want to continue to do the same things that we're doing now, right? Hand hygiene, masking, social distancing, trying to decrease the spread of this no matter what strain it is. As I said earlier, from a vaccine standpoint, right now, everybody is looking and it looks like that the vaccine will protect against these new strains. Andy, we can't hear you.
I'm sorry. There's recommendation about double masking. Can you speak to that?
All I can say is what the CDC has said so far. I have not seen any updates that they would recommend anything like double masking. I think the important thing is there are masks that are more effective. So when you're talking about a cloth mask, multiple layers, we know that things like neck gaiters and stuff like that that are just one thin layer of clothing are not as effective. Surgical masks are obviously effective. So I think the key thing there is just making sure you are wearing things. What we have found as a health system, and I think other health systems have shared this, is that when a lot of the spread occurs is not when people are wearing face coverings, it is when they let their guard down. So when they're eating with their colleague, their fellow employee, they take their mask off and they're sitting right next to each other. That is where we have seen that the COVID-19 spread. So those are really the things. So it's really just do the things that we know work and you will be protected.
Excellent. Love all the questions that are being sent to us. Another one was, I was told that if you had COVID-19 in the past 90 days, you can't get vaccinated. Can you speak to how to address those who had COVID?
Yeah, so another really great question. So what we know is that if you've had COVID-19 in the last 90 days, there's no reason that you can't get the vaccine. Now, some people say, oh, I want to wait, and that's okay. We know that after you've had the COVID-19 infection, you have protection for about 90 days after the infection. So the chance that you would get reinfected during that time is very low. The one exception to that is that if you were one of the patients that had COVID-19 and got the antibody treatment, what's called monoclonal antibodies, then we know that we believe that decreases your response to the vaccine. So then you should wait 90 days if you're in that category.
Great. Another question about the session, is it being recorded? The answer is yes. And what we'll do is place this recording on our website. And again, we'll follow up with an email to all of you participating with a link to that site. Another question, will a fully vaccinated person still be able to pass the virus on to someone else?
Yes. If you are fully vaccinated, you can still get COVID-19. And if you get COVID-19, you can still be infectious. What I can tell you in the studies, there was obviously I told you it's 95% effective. The other thing that the studies did show is that your chance of getting a severe case of COVID-19 is less. Pretty significantly less, and so another reason to get vaccinated. But you can still get it if you're vaccinated, and you can still pass it on. So that's why these measures that we talk about, the masking and hand hygiene and social distancing, are still important.
Great. Another good question: if someone contracts COVID-19 after receiving their first dose of the vaccine, are they still eligible to receive the second dose?
They are. Obviously, being in healthcare, we are having this happen to employees. And so we've had to deal with this very early on. So if you get your first dose or your first vaccine, and then you pick up COVID-19 in there, which can happen, right? Remember, we said you're only about 50% protected. What you would do is you would get the second dose. You just want to make sure that you're out of what we call the transmission-based precaution. So that 7 to 10 day window where you could spread it. We don't want you around or coming in and possibly spreading it to someone else. We obviously being careful, and it's the same for our employees. So once you're outside that 7 to 10 day window, usually it's 10 days is what I can tell you, then it's okay to come in and get your second dose at the proper interval. So for Pfizer, it's 21 days. For Moderna, it's 28 days.
Great. So any last parting words, Dr. McElwee, Dr. Godecker, based on this conversation? Any additional things to add?
I'll let you go, Eugene, first.
No, other than if you do have questions regarding the antigen testing, please submit an email. We recognize that there may be some nuances or some of the things that we spoke about during this webinar that may not be applicable, but we do recognize that there may be some other circumstances where the testing may be a thing for you to use. So, yeah.
And Andy, I want to emphasize how important it is to encourage all of your family, your friends, your employees, everyone to get this vaccine. This is obviously, it's only one thing that we can do to prevent and slow the spread. But the more people we get vaccinated, the more likely we are to slow down or stop this vaccine or this virus from continuing, and this pandemic from continuing. So please, please, please encourage people, make sure to share what you've learned today. The vaccine is safe, it is effective, so please share that.
Wonderful. Well, that concludes the questions for today. Really appreciate all of you taking the time to invest in this webinar. Again, this is recorded. We'll make sure that you get a link to this recording. We'll also follow up with an email with some other helpful tips that you can share with others as well. So again, hoping that you found this to be informative and helpful. And if anything that we can do as WellSpan to support you in your efforts, please reach out to us. And we encourage you again, please stay safe, stay well, and thank you again for your time today. Have a great day.